Hey, thanks, Mary. All right. So my name is Dr. Kyle Davis. I'm a clinical psychologist. I've been in Boise for about 10 years now, and I specialize in health psychology. And more specifically, I primarily help people with sleep disorders these days. And so I have a insomnia or primarily an insomnia focused clinic in my private practice. But I also do some work with helping people like chronic pain and weight management and other types of behavioral health conditions like depression and anxiety. And I also work part-time at St. Luke's with the Lifestyle Medicine Clinic, where I primarily teach health education classes. Um, but I wanted to give a little bit of background about how I got started with motivational interviewing. So right out of graduate school, I did a postdoctoral fellowship in primary care mental health integration. So I was a behavioral health provider working in a primary care clinic. And, I was seeing lots of patients that had all sorts of, chronic health kinds of problems, so high blood pressure, obesity, diabetes, that kind of stuff, and stuff that people potentially could have a huge influence on their life if they were able to make changes to things like their diet, their physical activity, their stress management skills, how they were thinking about things in their life. And so I got really interested in motivational interviewing because it is such a amazing way to communicate with people to help them figure out what they want to do for their own reasons. I could spend all day, trying to convince somebody of why they needed to change, but that may not do them a whole lot of good. What we know is much more helpful is, having people find their own reasons for changing their behavior. And so around that time, I became more skilled in motivational interviewing, and I started doing trainings in motivational interviewing for all sorts of different groups. So I was working in the healthcare, like I was at that point in time, I was at the Boise VA and was training folks and doing some training in motivational interviewing there. And when I started working at St. Luke's, I started doing a lot more training in motivational interviewing. And around that time, I got to know Gabe Rudow, who used to work at Empower Idaho. And I started doing these kinds of trainings with peer support specialists. So I've done these off and on over the last 10 years. And I'm guessing I probably presented this particular presentation 6 or 7 times over the last several years. I'm curious, has anyone been to one of my presentations before in motivational interviewing? I was just curious. I was asking and I guess Alejandra has definitely been here before. Um, oh, awesome, Lisa. Yeah, I figured that at least maybe a couple of you have. So anyways, I'm really glad that you all are here again. And we were just chatting about how there's so much information in this presentation that every time I teach it, I come away, learning something different about it, or emphasizing a different aspect of it. As my thoughts about clinical work, evolve over time. So if you've been here before, great. I'm glad to have you back. And if you're new, don't set the expectation for yourself to memorize everything right off right off the bat, because it takes a lot of practice to get skilled at this stuff. But anyways, really glad that you all are here. And it's so, I guess I get really excited about these kinds of presentations because if I'm able to help you all gain some more skills to have better interactions with the people that you're trying to help, then that allows me to play a role in helping more people in our community, which that's the kind of stuff that like I said, get pretty excited about. So anyways, happy to have you all here today. Okay, so our main objectives, and these may be clues for anybody who's taking notes about the quiz questions that come at the end of this. So we want you to understand the definition and spirit of motivational interviewing. I want you to be able to describe or name the 4 fundamental processes of motivational interviewing. And then I also want you to walk away with understanding some of the core interviewing skills in motivational interviewing, or things that you would want to emphasize in your interactions. Okay, yeah. So I'm noticing the chat. It sounds like some people are having troubles with the audio, but yeah, thanks, Alejandra and Eden for trying to help people out with that. Okay, so this presentation is broken down into 8 parts. And so it takes about 2 hours to get through everything, and I'll do my best to keep us on time. So in this first part, we'll talk about the spirit and history of motivational interviewing. Then we'll talk about how to engage people and core listening skills. Then we'll talk about core interviewing skills, or how to talk to people to help them feel understood, and also start getting them to talk about why they would want to make changes in their lives. We'll talk about people's values and the role that that plays in behavior change. We'll talk about focusing and exchanging information, ambivalence and evoking intrinsic motivation, how to respond to change talk, sustain talk, and discord. And you'll know what all these things are by the end of the presentation. And then evoking confidence and developing discrepancy. And then the last part here, helping people develop plans and supporting them as they move forward with making changes. All right, so in our first part here, we have even more specific objectives. So the definition of motivational interviewing, factors associated with behavior change, and how common communication styles in healthcare affect behavior change. Oops. All right, so I'm going to do a little demonstration here, and I want you all to know that I am not using motivational interviewing in this interaction. So I'm going to act like I'm a new peer support specialist, and I'm out there doing my best to try to help somebody that's having a hard time. So this particular, or I guess Mary is my guinea pig in this situation. She graciously volunteered. And I've got my pronouns wrong here, but her symptoms of depression, and she's working on avoiding losing her rental. And so I want you to imagine that you're in your peer's position, and just monitor like how it makes you feel, and whether or not you would feel supported and ready to make some changes. So Mary, I heard you've been having a hard time, making ends meet, and you may be in danger of losing your rental. Is that accurate?
I lost my job, and I don't have enough money to buy groceries, much less pay my rent.
Oh, I see. Oh, well, you know what? I've been in your shoes before, and I know exactly what you need to do to get out of this. So you've got to keep applying for more jobs. That's fundamental. And I know that you're probably having more problems with depression right now, but you've got to get out there and keep applying. I know that your rental is, really important to you. Is that something that you think you can do?
It's hard for me to get up in the morning. It just seems like it's all just piling up to the point where I can't do anything.
Yeah, well, that's somewhere that most of us have been before, and you just got to keep putting one foot in front of the other. And I know it's hard, but you've got to take these steps, so that you can, get another job and be able to pay your rent. So yeah, once again, is that something you think you can do?
I can try.
Okay, so let's take a step back here, and to be honest with you, it makes me so uncomfortable to do that. But I'm curious, what were your all's reactions to that? If you were in Mary's shoes, how likely would you feel that you're just ready to go out there and apply for jobs? So let's use the chat box for this. How did I make you feel talking to you like that? Yeah, people feel judged, under pressure, like you got to do something, like I don't really understand what's going on. Um, yeah, like I'm just directing you to do things that you already feel defeated on and bound about. Yeah, maybe it felt condescending. Um, I'm not acknowledging anyone's feelings. Um, And yeah, I didn't reflect anything. I just basically said, I've been where you've been before, and this is what you need to do to get better. Once again, I was feeling squirmy, even just saying this stuff. Um, and I'm curious, like, how often do you feel like this stuff kind of happens to people, that are seeking support, when they reach out and look for help? Do you feel like people end up talking like this? Okay, so thanks, Cecil. So I'm not really off track here with how I'm interacting. All right, well, let's try something different. Okay, it sounds like most people felt like they are less likely to change their behavior because they're just getting more and more down. When I'm telling them something that they already know. Um, Yeah, yeah, we all want to feel smart, and so we give lots of advice. But the truth is, that people already have, most of this. They know what you're going to tell them. Okay, so now I'm going to model some skills for motivational interviewing, and I want you to notice any differences in your reaction. So, Mary, can you come back on for part two of our role play?
Okay.
All right, Mary. So I've heard that you've been having a really hard time recently. Can you tell me a little bit more about what's been going on?
I lost my job and I don't have enough money to pay rent. It's hard to buy groceries right now, and the bottom line is getting smaller and smaller.
Oh, I'm so sorry to hear that. I bet it feels really overwhelming right now.
Absolutely.
Yeah. Geez. Well, I really want to help you out with this. How do you think I could be of most help for you today?
Well, maybe you can give me some ideas on where to look for work.
Awesome. Yeah, that's definitely something that I can try to help you out with. Um, well, let me start with like, what have you already been trying? Have you looked anywhere else yet? Or I don't want to, tell you something that you already know, but I definitely want to help you out with this.
Well, I've gone to a couple of places in town, but I have to tell you, I'm feeling so low that it's hard to get out of bed in the morning. I don't know what to do.
Yeah, so you're looking for jobs, but it just feels really overwhelming. Yeah, because your mood is more down and it's hard to
Hmm.
to even get out of bed. Well, it sounds like you're on the right track. I'm glad that you're looking, and I'm curious. Considering where your mood is at right now, what does feel reasonable to you in terms of I'm guessing that going in and applying in different places for jobs may be a little too much right now. But what do you think you could do to help kind of get started in that direction with something that you feel like you could do right now?
Well, I guess I could talk to my friends and see if they've got any ideas. Maybe they can help me out some because it seems like doing it alone is not working out as well as I hoped.
Yeah, that is an awesome idea, Mary. I think oftentimes, like having a connection is how people get jobs. So if you were able to reach out to friends and see if, there are any openings where they're working, yeah, that would be a great place to start and probably helps you work a little bit smarter, instead of, just like showing up at different places with an application. You can do some of this background work now and then increase your odds that you could, get accepted for the job later. So I'll go ahead and stop it again right now. But what were people's reactions to how I was interacting with Mary that time? And I was really trying to reflect a lot. I was trying to get her to come up with a plan, like we're working together. Um, yeah, supporting her ideas. Yeah, I was letting her be in charge. I was asking her how I could help her instead of telling her what she needed to do. Yeah, I was trying to let her come up with her own solutions. Yeah, asking her what she thinks she can do and supporting that. Yeah, instead of telling her what to do. Um, yeah, you all are yeah, describing exactly what I was trying to do, using the skills of motivational interviewing. And one of the reasons I really like to start with this activity is motivational interviewing is so much more of a style of communicating with folks than it is, a set of things to do when you're talking to someone. And it's hard to describe that sometimes. And so, just being able to demonstrate that, I think, can give people a better feel for what we're shooting for here. So, what is motivational interviewing? And I love this little cartoon because, if we go or back in time, whenever I was telling you all about working in the primary care clinic at the VA, doctors would send me patients and they're like, can you fix them? It's like, I don't know what else to do. Can you do your psychology stuff and, change them? And I was like, that's not what motivational interviewing is about. That's not what being a good therapist is about. But I will certainly meet with your patients, and try to help them, come up with their own reasons for changing. So, a formal definition of motivational interviewing is a collaborative, goal oriented style of communication with particular attention to the language of change. It's designed to strengthen personal motivation for and commitment to a specific goal by eliciting and exploring the person's own reasons for change within an atmosphere of acceptance and compassion. So, it's really probably the most important word there is it's a style of communication. It's all about coming into the conversation with the idea of like, how can I get this person to identify and think about like how they want their life to be different, why they want to be doing these things. And I take my own judgment, and thoughts about this stuff out of the picture, and I'm just there to support them, which honestly is so much more liberating as either a therapist or a peer support specialist, because you're just trying to help them do what they want to do instead of trying to answer all the questions for them. And if you've been in that position before, that can feel really overwhelming, when people feel really overwhelmed. And so once again, it's all about helping people come up with their own reasons and plans for change. So our 4 specific processes of motivational interviewing, so we'll be reviewing this throughout the presentation today, are engaging. You've got to engage someone before you can move on to these other stages or processes. So we move from engaging to focusing on specific issues that we're trying to help someone with, to evoking change talk, and then planning for change in the future. And once again, we'll be revisiting these several times today. Okay, so a little bit about the history of motivational interviewing. Like lots of things, motivational interviewing was discovered on accident. And so it was originally developed in 1983 as an intervention for alcohol dependence. So motivational interviewing is as old as me. And what was initially happening, so the psychologist, Bill Miller, that kind of discovered fleshed out motivational interviewing, was studying interventions for alcohol dependence. And what they did was they were doing a study where they were trying to test a therapy intervention for helping people reduce their use or cut back on drinking, but they needed a control condition for their study. And what they chose for their control condition was, let's just give people objective feedback about their alcohol use. And so basically the way that happened, is they would say, they would give these people feedback like, this is how much you reported drinking. This puts you in the percentage of, you're in the top 3% of alcohol users, and these are the kinds of problems, that people are likely to run into, when they're using this much alcohol. And what they found was that the control condition, just giving people this objective feedback, was just as effective as their therapy intervention, like where they're trying to, tell people why they need to change and help. And they're obviously trying to help support them in that. Instead of just saying that their therapy intervention didn't work, they realized that what was going on here is that just giving people objective feedback and letting them think about things themselves and come up with their own plans was an effective intervention in and of itself. And once they discovered this idea and started applying it more in substance use situations, they realized that it could expand to basically all aspects of healthcare or behavior change. And so motivational interviewing has been, like, you name a certain type of health condition or behavior change concept, motivational interviewing has likely been applied to that. So everything from, promoting good study habits, to flossing your teeth, to taking medication regularly to manage diabetes, or making healthier food choices or exercise choices, motivational interviewing has been demonstrated to be effective. So any questions about that before I move on? So I do try to keep my eyes on the chat box as I move forward here. But hopefully all that makes sense. Okay, so motivational interviewing is kind of loosely revolves around the stages of change model. This is called the trans-theoretical model of behavior change. How many of you have seen this before? So this model was originally developed in tobacco cessation work. And just like kind of like the alcohol dependent stuff, they realized that this particular model, once again, applied to all sorts of different kinds of behavior change, not just cutting back on tobacco, but really any change that somebody's thinking about making. And so what the model says is it has 6 distinct stages that people will move through whenever they are considering or start making changes to a part of their life. So the first stage is pre-contemplation, and pre-contemplation means like changing isn't even on your radar. It's like you're okay going along the way things are. And then somebody reaches the contemplation stage when they're aware that a problem exists. They're like, something has to give, but I don't know what it is. But there's a problem and this doesn't feel sustainable anymore. And then once somebody moves from contemplation to preparation, they start thinking about what they could do differently in the future. So now I'm, like getting ideas, getting different, maybe I'm starting to make plans for change. And then action occurs when somebody starts doing something differently. And then when somebody has been doing that for several months and it's becoming more routine for them, then they've reached the maintenance stage. And then oftentimes, once again, depending on, what type of behavior change somebody's making, they'll experience a relapse. They'll fall back into the old behavior or not doing whatever new behavior they were doing. And our job becomes helping somebody get back on track as soon as possible. We want to minimize the relapse time. But the good thing is somebody doesn't have to go back from relapse to all the way through pre-contemplation, contemplation. We can jump right back into action and move back into maintenance. And so, like, whenever I'm helping people make dietary changes, like that's an area where people are almost certainly going to relapse. We just want to move back into action as soon as possible. And so this ties in with motivational interviewing, because you can kind of think about, whatever you're trying to help somebody with is then being in a particular stage here. And so I'm sure you all have examples in mind of people you met with, that are really in pre-contemplation. They don't even know why they're meeting with you or something. And then once again, and then people that are, maybe reaching out for help, that are in the preparation phase. So you can kind of to think about where they're at and think about your job as helping them move through this continuum. So if I'm working with somebody in pre-contemplation, I'm not trying to get them to commit to action at that point in time. I'm trying to move them along the continuum here and move them to contemplation. So if they're not thinking about a problem yet, I want to help them be aware that there's a problem that could exist. And so I'm moving them into that stage. And if somebody's already in the preparation stage, then I'm going to help them move into action. So like in my example with Mary a couple minutes ago, she was probably in like contemplation, preparation, and we were starting to get into action. Like, what can you do to start applying for jobs again? Because she was ready for that, because it was important for her. And if somebody's in action, I want to move to maintenance. So does that make sense, how you try to move somebody through these different stages until they get to maintenance? All right. Really appreciate your feedback in the chat. Thanks, Devin and Katie. So I wanted to talk a little bit about how people typically help other people change behavior. And maybe I'll ask you all, how have people tried to help you make changes in the past? How did they go about that? What do you all think? So if somebody were trying to help you, what are different ways that they tried to help you? And once again, I'm not saying what was the most effective way for them to help you. I'm just saying, how did they try to help you? Yeah, so maybe they were making suggestions, they were sharing unsolicited advice. Yeah, lecturing, telling you what to do, showing by example. Okay, yeah, maybe showing by example, like, yeah, giving different ideas. If that's something you're ready to hear, then that could potentially be helpful. Okay, shaming, blaming, guilt. Yeah. Yeah, so you all are coming up with a combination here. Some of these things sound pretty helpful, and then some of them sound like it was not very helpful. So oftentimes, in healthcare, and once again, I think in any kind of behavior change setting, whether this is with family members or healthcare professionals or the legal system, people are going to follow some pretty standard ways of doing this. So, people love to give advice, like we said earlier. People love to give orders to say, you have to do this. In healthcare, we love giving more information or handouts, like, oh, you have a problem with sleep, here's a handout about that. Oh, you need to exercise, here's a handout about that. And it's like, I just feel like rarely are those things all that helpful. Maybe sometimes they are, but oftentimes it isn't a lack of information that people have. It's probably a lack of motivation or just not knowing where to start. Or sometimes we try to scare people into changing. We say, this is what's going to happen to you if you don't make changes. And then people, oftentimes like feel guiltier or afraid, which usually doesn't help them maintain long-term change. Or, maybe they provide empathy and support, and that can certainly be helpful. But if that's all you get, then that may not be the most helpful thing for you in that situation either. And then this is kind of very similar to the question that I was just asking you all. But let's go to this one. So what do you think are the most important factors in helping someone change a behavior? Oh, that's cool, Chris. Yeah, you like run through different scenarios and then let them make a choice. So the most important factors in helping someone change a behavior. Chris is getting at one of the things here. So if I'm giving somebody several different options, or like working through to generate a list of different options, I'm really supporting their autonomy. I'm letting them make choices for themselves. And that is going to be one of the most important factors. Um, yeah, so letting people be heard, give them options. They have to be ready and wanting to change. The ideas have to come from them. Exactly, Tina. Yeah, listen, come work with them to come up with choices. Yeah, maybe you're asking questions like, how does these behaviors negatively impact your life? Um, Lisa, eliciting a reason from them why they would like to make a change. Excellent. Yeah, and then Katie, patience and being able to walk them through the decision they want to make. Yeah, and then helping them be realistic, about different consequences. Um, Yeah, you all are talking about really helpful strategies here. I always, I love giving these presentations to the peer support specialists because you all are so like naturally attuned to this. It's like what works and what doesn't. And so oftentimes you all are, using a lot of skills from motivational interviewing just by being yourself, and knowing like what feels best when you're trying to help someone. I often find that I think nurses are oftentimes a lot better at this than doctor or physicians are. Doctors are used to telling people what to do, and nurses are used to supporting people. And so, like when I teach nurses this, they're like, "Oh yeah, that makes so much sense. That's what we do already." And then physicians are like, "I have to ask them why they want to change, but I'm telling them to change. Why don't they just do it?" That's not how people work. Um, Okay, so this is more theoretical, but when you're thinking about why people change behavior, they have to be intrinsically motivated to change. They have to want to do it for themselves. And you all were saying that in a lot of different ways in that last question. So that's got to come from within. Other times, people may change behavior because of extrinsic motivation. They're trying to obtain or avoid something from outside of themselves. And that can be very motivating, especially in the short term, but is usually not most helpful in the long term. And then people also have to have self-efficacy to change behavior. And what we mean by that is they have to have confidence that they're going to be able to do those things. So our job becomes helping people find their motivation to change, and then also help them develop their confidence to change the behavior. So what is motivational interviewing not? So motivational interviewing is not reverse psychology. You're not trying to trick somebody or coerce somebody into doing something, even if you think it would be in their best interest. It's got to come from them. It's not a strategy to make people do what we want them to do. It's a strategy to help support them do what they want to do. And I remember talking to one of my physician friends when I was talking about motivational interviewing. He's like, it's like judo. You like trick them into doing like what they need to do for themselves. And I took issue with that. I was like, I'm not tricking them. I'm just trying to help them do what they need to do for themselves. It's not something you do to another person. You don't say, I'm going to go out and motivationally interview this person today. It's like you could say, I'm going to use skills from motivational interviewing to help support them. But it's not something you do to another person. So once again, motivational interviewing is all about, kind of how you're thinking about supporting someone and, where you're coming from when you help them. And then I've got one last slide here on conversation styles or something to be thinking about. So we've got three different things here. We've got directing, where we're providing information, instruction, and advice. There's following, where we're listening and trying to understand what others are saying, and we're refraining from inserting our own thoughts. And then we also have guiding, where we are combining directive and following styles and using each style when appropriate. And when we get really good at motivational interviewing is like this dance where I'm going back and forth between directing and following, based on what I'm getting from the person I'm trying to help. So sometimes I need to be following more. Sometimes I need to be directing more. And that's can be a pretty delicate dance to try to learn. But it's a really helpful thing to remember that your job is to help guide them. And you're going to be bouncing back and forth between those directing and following styles. Okay, let's move on to engagement and listening. So we want to think about things that help engage our peers, what disengages them, and also talk more about reflective listening. So imagine that you are a peer and you're meeting with your new peer support specialist. What kinds of things are going to help you feel engaged with them? What do you think? Okay, maybe somebody just needs to vent or let some things out. Um, yeah, maybe you're getting feedback on what I'm saying. That's great, Sarah. Um, yeah, maybe you're sharing common experience or they're sharing common experiences, feeling like you can relate to them. They're asking you questions. Um, Sandra, is giving advice not bad? It depends. It depends if they're asking for advice. We don't want to just give unsolicited advice, but if somebody is asking for advice, then that's not bad. Okay, yeah. So people that are finding common ground with you, interests or similar experiences, being an active listener, helping somebody feel like they're not alone. Um, so things to be thinking about. And I know that you all have probably been in these situations yourselves, but people are going to be wondering, like, do I feel respected? Does this person respect me as a human being? Does my peer support specialist, are they listening to me? Are they understanding me? Many of you were saying that. Do you feel like you can trust this person? Um, do you have a say in what happens in our meeting, or are they just telling you what to do the whole time? So these are the things, that are going to be going through someone else's minds whenever you're meeting with them. So these are the things that we really want to focus on, helping people feel respected and understood and being trustworthy, setting an agenda, talking about what they want to talk about. So how would you know if your peer is engaged in their recovery versus just kind of being a passive bystander? What would you see from them? Yeah, they're doing things, their actions. They're actively trying things to make change. They're asking for advice and feedback. They're talking about goals. They're asking questions. They're coming up with their own goals. Recovery talk, talking about their changes. Yeah, maybe they seem excited about the direction that their life is going in. Yeah, they're more self-aware. Yeah, they're brainstorming possibility. Yeah, these are all great answers. Um, okay, so you'll know that your person is engaged in their recovery if you feel like you have a mutually trusting and respectful helping relationship. You're in agreement on their recovery goals. You're collaborating on mutually negotiated tasks to reach these goals. And this is really what you all are talking about in terms of giving people options, or helping them generate a list of things that they can do and choosing the best choices for them. Um, sorry, my mouse is being a little finicky. So yeah, those are all things to be looking out for. Okay, and then common traps that lead to disengagement. So how to not strengthen your relationship. So assessment oriented conversation, like when you're just asking tons of questions, especially if those are like closed questions or yes or no kinds of questions. Um, um, so I like using the example of, like, one time I went to the dentist, and this is a great place to think about, like um, how somebody interacts with you either encourages or discourages behavior change. So like, let's say you're meeting with the dental hygienist and they're saying like, how many times do you brush your teeth a day? How many times do you floss a day? Do you know that you should be flossing every day? You should be doing this, you should be doing that. These are the problems that you're going to run into. And I know, like, after I was thinking a lot about this stuff whenever I had that dental appointment, I was like, I feel way less motivated to take care of my teeth now, because I was just, nobody asked me, about why I would want to do that or why I would care about that. It was just very kind of prescriptive. This is what you need to do, and we're not even really telling you why. We're just saying that this is what you should do, or else. And so, yeah, that can be a big turnoff. And what can work a lot better, as we've been saying, is asking people questions about things, and letting them ask their own questions about it. Okay, so other turnoffs: taking an expert role in prescribing change, saying this is what you have to do. Once again, if that's somebody that they're not asking for that, there is a place for that, when people are asking for it. Premature focus. Sometimes, and I'm guilty of this too. I'll pick up on something and I think that is like the root of the person's problem. And I get really, I think that that's the thing that we need to be focusing on the most. But that may not be the thing that person thinks is the biggest issue. And so I have to be careful about, like, what I think the most important things are, so that I can, meet the person where they're at. Labeling is another problem. So if you just like say, oh, well, that's because of this, or you're just kind of like writing it off to a specific label, usually people don't feel very understood. Yeah, Brad, I just saw your comment. You're right. The dentists assume that you feel the same way about your teeth as they do because it's so important to them. And then that's why they're in that job. But yeah, that may not be, but I'm not a dentist, right? So yeah, once again, that's really insightful. And then blaming, that's rarely helpful. It's like, well, you brought this on yourself. That's going to be a big turnoff. And then also making small talk. That's another thing. It's like people will make small talk, to try to build a relationship with someone. But if you don't move on from that, then that's not going to be very helpful either. Okay, so let's talk about listening. How do you know if someone is listening to you? How would you know? Yeah, they can reflect back to you. Maybe they're asking clarifying questions. Yeah, eye contact. Um, yeah, nonverbal engagement. Like maybe if they're like facing you or have similar posture as you. Yeah, feedback and body language. Yeah, you can literally repeat back to them what they said. And then how do you know if you're listening to someone else? Yeah, they're your focus. And once again, it would be the same kinds of things, right? That um, you could repeat back what they just told you, if you were really listening to them. So reflective listening becomes like one of our key skills in motivational interviewing. So the goal of reflective listening in the process of engagement with your peer is to help them feel understood and form an alliance with them. And so this is something that I think can be uncomfortable for people, to make these kinds of reflections, sometimes, especially if you grew up in a place like where maybe no one ever reflected anything to you, growing up. People were always telling you what to do and they didn't care what you thought about things. So they never took time to make a reflection. It can feel pretty uncomfortable, if you've never had interactions with folks, that were reflecting what you were saying. And so that's why this becomes a skill that we really want to focus on helping people build up. So reflective listening is like one of the fundamental communication skills in motivational interviewing. So the essence of a reflective listening response is a statement that makes a guess as to what a person means. So the basic level, you're really just kind of repeating back to somebody what they just said. And then at a more complex level, you're making inferences about what somebody is saying or feeling in your reflection. So I've got an example here in the little picture. So like a simple reflection could be something like, oh yeah, those people are really on your case about coming to a support group. And then a complex reflection would be something like, well, it doesn't sound like it was your idea in the first place to come to group. And you're not sure that this is going to be at all helpful to you. So once again, maybe that person hasn't said that yet, but I'm making an inference about it. And that really can help somebody feel understood. And if you're wrong, which you may be, it still like gives them an opportunity to correct you, or make a clarification about what's really going on for them. But it shows that you're engaged and you're trying to listen to them whenever you make those complex reflections. And here, this is like one of my favorite statistics about motivational interviewing. So those that are really skillful in motivational interviewing offer 2 to 3 reflections on average for every question they ask. Whereas in a typical conversation, like with somebody that's helping somebody else, questions typically outnumber reflections 10 to 1, which is just wild, to think about like how much more somebody is emphasizing reflecting versus questioning when people are really good at motivational interviewing. They're essentially using their reflections to get the information that you would get by asking questions. And so because it helps somebody feel more understood than just asking them a whole bunch of different questions. So like in these like big studies of motivational interviewing, when they're trying to see like what are the effective components of this, researchers will literally transcribe every single thing the therapist says. And then you go back through and you code them as, was this an open-ended question? Was this a reflection? Was this an affirmation? Was this a closed statement? And so you can code like all the different things that the person said. And so that's how we know that reflections are one of the most helpful components of motivational interviewing, from these like research studies where we're looking at everything that the person says and then looking at the outcomes, to see if people change behavior. So once again, if you start doing this and you're trying to make lots of reflections, it's probably going to feel uncomfortable, and that's okay. It's like, earlier we were talking about like motivational interviewing is like a dance. If you're learning a new dance for the first time, it's probably going to feel a little awkward and comfortable or uncomfortable. And, trying some of these skills can be the same way. But once again, that's what we're shooting for. All right. Any questions about that before we move on? All right. Not seeing any. Okay, so let's talk about moving on into our core interviewing skills and also the importance of values, which is one of my favorite things to talk to people about. Okay, so core interviewing skills. So I've got my silly picture up here because the acronym for our core interviewing skills are OARS. So open-ended questions, affirming or making affirmations or affirmative statements, reflecting, and then summarizing. So let's talk more about what all these are. So an open-ended question is something that you can't answer with a yes or a no kind of response. So if my dentist says, are you flossing twice a day? That's a closed question. That's a yes or a no kind of question. If my dentist says, tell me about what flossing is like for you, Kyle. Then that's an open-ended question. You're gonna get a lot of the same information from either way. But what do you all think are the benefits of asking open-ended questions versus closed questions? Yeah, you gain perspective. You can get so much more information. You can learn about how somebody's thinking about something by asking an open-ended question. You can learn from their internal wisdom. Yeah, you're opening up the door, more room for information. Um, you get more feedback. You learn more about their skills and what they're able to do. You're starting a conversation. You all may be noticing that I ask lots of open-ended questions, in these like types of presentations. I'm constantly actually trying to model these skills, while I'm teaching. So I'm asking all these open-ended questions. You'll see I make lots of reflections when I'm going through your comments. And hopefully that we're accomplishing what Brad just said, that you feel more engaged and not like you're being interrogated. So open-ended questions invite a person to think before responding and allow for self-expression. And then that often leads to more information that can be helpful. And then closed questions can disengage your peer and you may miss out on a lot of important information. I'll just go back to my dentist example, like maybe I'll say, well, I only floss every once in a while, but this and this and blah blah blah. And I'm going to leave that with so much more information than if somebody is just like, oh, you don't floss twice a day, you should be, or you'll have gingivitis. So once again, you just get so much more information that way. And you're going to find that people are a lot more likely to change their behavior, if they're the ones talking about it versus being told what to do. Okay, let's move on to affirmations. So affirmations recognize and acknowledge that which is good, including the individual's inherent worth as a fellow human being. So affirmations provide support and encouragement, and good affirmations are different than praising. And this is important. So when you're making affirmations, these are typically going to start with, you're saying, you did this, like you're working really hard on this. Like in my example earlier, I might say, Mary, you've been having a really hard time with this and you're working so hard on getting back on your feet. And so versus saying like, I'm so proud of you, Mary. I think you're doing such a good job working on this. And, it's like, think about that for a second. It's like when somebody's telling you're doing this, you're doing that versus I think this or I think that, that feels different to me. Does it feel different to you all? Like if I tell you all, you are really engaged in the presentation and it's great to see all the feedback that you all are giving me versus I'm really proud of you all for interacting in the chat box today. I think you all are really learning this information. Like, how does that feel different? Yeah, Brad, nailing it again. So the focus is on their efforts, not on what you noticed. It's about them, not about me. So it's not about my judgment about, the other person. It's about what I'm noticing about them. So it's really focusing on them instead of my take on it. Because anytime that you're putting like your take on it or you're putting I in front of it, it makes you feel like you're being judged because you are being judged. If somebody makes a statement like that. And so it's a lot more personable and people are going to feel more supported. Unless there is some sort of power hierarchy, like where you want somebody's judgment on what you're doing, if you're going to somebody for support, it's like maybe you appreciate that. But I think most of the time using these affirmations where you're just commenting on what somebody's doing is going to be most helpful. Okay, and then our last key core interviewing skill, summary statements. So summaries are reflections that pull together several statements a peer has made. So summaries allow you to focus on your peer's strength and highlight specific aspects of the conversation. So I'm going to be really intentional about the information that I'm presenting back to the person I'm working with, or my peer, because I want to present to them what's going to be most helpful to them. So another like cool thing about summary kinds of statements is they allow peers to hear their experience in a more comprehensive way and see the forest instead of specific trees. So if I was talking to Mary again, I say, geez, Mary, it sounds like you were telling me like you've been having a really hard time, and you've been, going out and applying for jobs anyways. You've got great ideas about other potential leads for jobs, and you're just working super hard on this. I really hope it works out well for you. So I'm just like choosing like which things like I'm presenting back, and I'm being intentional about reflecting the things that are going to be most supportive to them versus like the difficulties that they're facing. Like if I'm reflecting back like her depression and how she's feeling, it's like, well, that may not be as helpful to her in coming up with a plan. So I'm being particular about the information that I repeat back or reflect back in my summary, because I want her to feel more supported and motivated. And then sometimes summaries can be collecting where they're just all these little pieces of information. Sometimes you're trying to connect different things, to help somebody gain more understanding. And then sometimes you can use a summary statement to transition into another topic. It's kind of like we're wrapping this up and putting a nice little bow on it, and then we're moving on to our next topic. But really, summaries are just reflections, but using them in a or like you're putting them together at the end of a kind of a conversation. Okay, now let's talk a little bit about values and goals. So understanding someone's values and their goals is essential to knowing them, like who this person is and what they're all about. And what we find with behavior change is that people are often living inconsistently with their values and long-term goals. And so I think of values as the part of people's lives that are really important to them. And when you get to it or get down to it, especially with people that are dealing with significant mental health issues, they're oftentimes living inconsistently with what's really important to them. And that can be some of the reasons that they're, struggling with something like depression. So if I can help somebody be aware of what their values are and how they may not be living consistently with what's important to them, then I can help them facilitate their own motivation for behavior change. So let's take a minute to reflect on values. And this may also be a good time to take a pretty short break. I want to give people, we're kind of at the hour mark. We'll give people a chance to run to the bathroom. So let's do this. Let's have you imagine yourself 20 years from now. And I want you to imagine that you're looking back at your life. What would you want to be remembered for? Like when people are talking about you at the end of your life, what stands out to you? What would you want to be remembered for? And then I want you to think about, what are you doing currently in your life that is consistent or inconsistent with what's really important to you? So let's take a 5-minute break here. You can use the bathroom, think about these questions, get a glass of water, whatever it may be. And then we'll pick back up at 10:40, and then we'll talk about this for a minute. All right. Are people coming back? Awesome. Okay. So I would love to hear some of your responses. And I know that this is kind of a big question to try to answer in the chat box, but I am curious, like what people um, were thinking about, like when you're thinking about what's really important to you and how you may feel like you're living consistently or inconsistently with that. And what are some of the things that came up for people? Yeah, so healing, probably healing yourself, healing other people, being helpful to people. Yeah, being a better person and being um, taking care of your family. And maybe you're trying to make the world a better place. And then, so the reason I have people do this values exercise is I like demonstrating the power of this. If you think about this seriously, it's like this can actually be pretty moving, to think about, what's really important for you and, whether or not you're living consistently with it. And so, like, this is something I want people to be thinking about when they're working with their peers or they're, um, like if I'm helping somebody like in the lifestyle medicine clinic, like my favorite question to ask people when they're trying to improve their health is why do you want to have improved health? What would improved health allow you to do in your life? Because I'll ask people like, why are you here? And they're like, oh, to improve my blood pressure, to lose weight. And then we've got to get into like, well, why is that important to you? And once you can start answering those questions about why people want their lives to be different, it's like then you start getting into their values or what's really important to them and how they want to be spending their time. And I know that somebody is going to be so much more likely to change their behavior if they can make a connection between how they're living and what's important to them. Um, so, okay, I'm going to look at your comments. Yeah. So I'm sure, is this something you think you all, or maybe you're already doing this, like when you're working with your peers, do you feel like the people you're working with well enough to know how they would answer these kinds of questions? Yeah, so some of you do, and once again, it's probably going to vary, depending on how well you know them or how long you've been working with them. But it's something to aspire to, right? Because if you really know what's important to that person, you're going to be in such a better position to help support them. And, like I'll share like one of my well, I was sharing this other question, but a way that you could ask, your folks that is you could say, if I'm able to help you get to be where you want to be in your life, how would things be different for you? Like, how would you be spending your time? What would you be doing differently? And, it's like that's going to give you so much information about somebody's values and what their goals are, and put you in a situation, to help support them in making those kinds of changes. So something to think about. And it's once again that's not a normal way of people trying to help each other. Like if you go to your doctor, they're there to help support you. But when's the last time, that a doctor asked you why you wanted to have improved health? Um, I'm going to guess that many of you that's never happened. It's like that's just not how we approach it. But imagine they did. And and then they're helping you manage your health in a way that supports your values and your goals. Maybe that's idealistic, but I think it's something that we can aspire to. Okay, so let's talk about focusing and exchanging information. And I also realize I'm going to have to be a little faster moving through the second half of this. Okay, so focusing is the process of clarifying the goal toward which you will help your peer move. So let's say you're engaged, you're buds, it's like you feel like you've got a good, that you're working together now, but now you've got to figure out what you're going to help them with. So focusing is necessary before moving to the next two processes in motivational interviewing. You got to know what you're helping them with before you move on here. So sometimes the focus is really clear, and other times it can be a lot more difficult to find. And so you can help your peer focus with the different engagement skills that we were just talking about. So one quick question for you all. How do you help your peers focus, or how do you all figure out what you're going to work on or what you're going to support them with? Yeah. Yeah. Ask them what they want to work on. It's that simple. Yeah, that's a great strategy. Okay, let's look at some other things to be thinking about. So Chris, yeah, I've listed things that they want to work towards, they can prioritize. Yep, that's great. So sources of focus. So first up, your peer, typically why they're coming to you for help in the first place. That is probably the most valuable source of information. Two, but the setting can also be important, or the context in which you're helping them. Like, let's say that you work I know some people here are like working with housing specifically. It makes sense that you may not spend as much time supporting someone with managing depression if you're in the housing setting. So you're probably going to be working on helping them find housing. Or another source of focus, and this is a little trickier, but you can also use lived experience. So you can use your own understanding of factors causing or maintaining a peer's presenting problem, and and you can present that to them, because you may be aware of something, like, let's say somebody's really struggling with alcohol use and depression and keeping a job or something. And maybe you've been through a lot of this kind of stuff yourself, and that alcohol is like this underlying thing, that's causing a lot of problems in somebody's life. Then you may bring that up, even if the patient, maybe saying like, I just need to find a good job, I just need to find a good job that I like, and then I'll be able to go. And it's like, well, the reason you lost your last couple jobs is because you weren't showing up, because you were too hungover. And, so like having that kind of insight, may give you room to bring something up that ultimately, could be the most helpful for the patient. I'm sorry, I keep using the word patient. I just think about healthcare. So helping your peers. Okay, so styles of focusing and choosing in direction. So sometimes there's a really clear single direction. Like when I'm treating people for insomnia, they want to work on insomnia. That's what I'm there to help them with. That can be really straightforward. Sometimes there are several possible directions. Like sometimes somebody has, like in my clinic, really overwhelming stress in their lives. And maybe it makes more sense for me to help them with stress management before we start moving on to or like sleep specific kinds of stuff. And then sometimes the focus is really unclear, and you're just going to need more time to explore what's going to be most helpful for someone. So this is kind of what I asked you all earlier, like, how do you all choose what to focus on? One strategy that sounds really similar to like what Chris is saying here is called agenda mapping. So this is a meta conversation, which you step back for a short time to consider with your peer the way ahead. And what we mean by that is, you're like listing and prioritizing topics for focusing, basically exactly what Chris said. So you're like listing all the things, that you could potentially work on, and then you start choosing what it is. And yeah, once again, Chris, I think you said that better than I did. And so you can also use summary statements. You can use visual aids, like if you have a notebook, you can write all this stuff down. If you have a whiteboard, you can write it down there just to get people to visualize everything that they could potentially work on. And so what you're supposed to be helping them with. Okay. And then once you focus and you feel like, okay, I'm going to help this person with housing. I'm going to help this person with their mood, or I'm going to help this person find a job. Then we want to start exchanging information. And this gets a little tricky because people get excited and they want to share advice. It's like, I've been through this before. This is what I've been training for, and here I am, and I'm ready to help. And so a common trap is, feeling like you're the expert on why and how somebody should change. Once again, I think peers are generally really good at not doing this, but this is something that you would see like doctors do all the time. So a better alternative would be like, what, I've got a lot of expertise in this, but each individual is the expert on themselves. So I'm here to help them do what's going to be best for them, because I can't, fully understand everything about them. Two, a common trap is like, I just need more information about the problems that they're having. And alternatively, maybe a better option would be to find out what information your peer wants and needs, instead of, just providing them with a ton of information that's irrelevant to them. Like, I had a patient last week who I asked, he was like really complaining about, an older man who was complaining about his sleep. And I was like, do you want to know what sleep looks like for people in your age group? And he said, no, I don't care. I know what's right for me. I'm like, all right, well, I'm not going to share that information with you because you don't want to hear that right now. Maybe later, but not right now. Okay, another common trap. So this is like what I was like testing. I rectify gaps in knowledge. I'm like, well, if he just knew what normal sleep looks like, then he could lower his expectations, and that could make a big difference. But that's not what he wanted. And so I match information to my peer patient's needs and their strengths. I try to meet them where they're at and give them what's going to be most helpful for them in that situation. Another trap, frightening information is helpful. I just need to scare them into this, and then, they'll be able to change. And, the alternative there is my peer can tell me what kind of information is going to be most helpful to them. And, sometimes people think I just need to tell them more clearly what to do. I'm just going to write it out for them and tell them what to do. They're just not understanding this. And once again, probably not the best advice. So we want to give advice that champions the peers' needs and support their autonomy. I want them to feel like they're in charge of what they're doing. And this is part of the presentation that can be a really great take home kind of thing. So anytime that you're exchanging information with someone, you can use this elicit, provide, elicit strategy. So what we start with is asking for permission for something. So this would be like in my example about sleep. I may say, it sounds like there may be your expectations, for sleep maybe be a little bit different from what I think is possible. Like, would you want to learn more about that? And most of the time, somebody's going to say, yes, please, give me more information, but not always. So at that point in time, if I would have gave him that information, it wouldn't have mattered to him. It wouldn't have listened to it. And so I want to provide people with information that they want to hear. And so, well, they say, yeah, sure. Tell me about, what sleep looks like for an aging adult. Then I could provide that information. And, then I'm like, okay, so, now that you've learned this, what do you think about this? How do you think your expectations for sleep may be different than what would be normal for somebody in your age group? And so I'm going through this elicit, provide, elicit. I'm asking for permission, and if they say yes, I'm providing information, and then I'm asking for their take on it. And that's really important, because they may take away something different from what you provided than what you thought. So asking for that interpretation of what you were covering is a really helpful step. All right. So moving on towards working with ambivalence and starting to evoke intrinsic motivation. Now we get to talk about change talk. So ambivalence is the state of having mixed feelings or contradictory ideas about something or someone. So if I'm thinking like, oh, I should maybe exercise today, but there's a part of me that wants to exercise, there's always a part of me that doesn't want to exercise. I'm feeling ambivalent about that. What are some examples of ambivalence that you see when working with your peers? What are they getting hung up on? Yeah, wanting to change, but having a fear of it. What ifs? Yeah. Maybe they're just not feeling motivated. They're not sure it's going to work out, or maybe they're getting something out of their current lifestyle that they're not ready to give up. And what behaviors are you talking about changing? So they've got the idea or desire to do what, but no motivation. Um, oh, okay. Yeah. Like wanting to make more money, but fearing losing benefits. Oh, yeah. Maybe they're ambivalent about it because other people want them to make the change, but they don't know that they're ready for that change. Or oftentimes these examples like work related or um, housing related or maybe like mental health related. Okay, yeah, so that's kind of like wanting to stop drinking, but not addressing underlying issues. Yeah, that's the kind of thing that I was curious about. So they're getting something out of drinking, which is probably avoidance, if you're talking about these underlying issues. Um, but they also, want a different life for themselves. Yeah, that's the kind of stuff that I'm thinking about too. Yeah, maybe wanting to have more social interaction, but coming across in aversive kind of way, like swearing or, yeah, making threats. It's hard to be friends with people that are threatening you. Uh, Okay, so we want to help people resolve their ambivalence. So our goal is helping our peers explore and resolve their ambivalence about behavior change by eliciting change talk. So change talk is like the goal in motivational interviewing. So change talk is any self-expressed language that's an argument for change. So if I'm talking about doing something differently, wanting my life to be different, that's change talk. And change talk is like gold in motivational interviewing. I want as much change talk as I can get from the people I'm trying to help. So you're going to see there are different types of change talk. So there's preparatory change talk where people are talking about why they need to change. So they're talking about desire. They're talking about how they could potentially do it or their ability to make changes. They're listing reasons for why they would need to change or why they want to change. They're telling you why they need to change. Um, and then when somebody is, actually starting to make changes, you're going to hear more mobilizing change talk. So they're making commitments to making changes. They're literally doing things differently. They're activating they're taking steps toward change. They're starting to do things differently. And you can see here, we've got a handy acronym to remember these. We've got DARN CAT. So DARN stands for desire, ability, reasons, and need. And CAT stands for commitment, activation, and taking steps. So this is the kind of stuff I want people to talk about. So if I'm working with Casey's peer, I would want to know all the reasons that this person would want to stop drinking, how their life would be different. And those are the questions that I'm going to ask them. And then once they start saying that, I'm going to reflect it to them. So I get them thinking more and more about why they would want to make this change. And then the alternative to change talk is what we call sustain talk. So these are your peers' stated reasons not to change or to maintain the status quo. So what I try to do is be skillful in eliciting change talk and steering my patient away from sustained talk. Like, I don't want to spend all of our time talking about why they would want to stay the same way. I want to spend our time talking about why they would want to change. And then we know that behavior change is directly associated with increased change talk and decreased sustained talk. So I'm trying to increase change talk and get less sustained talk as we're moving through that process. And I know the person that's, telling me all the things that they're trying to change and why they want to change. Those are the people that are going to be most successful. And that's when I'm teaching those classes about changing lifestyle, why I'm asking them, why would you want your life to be different in the future? Because that's all change talk that they're going to bring up. And that's what I want to hear. Oh, Tammy, I love that strategy. Just a little reframe there, and that can be super helpful. Okay. So evoking change talk. How do we get people to give us more change talk? I can ask open-ended questions for which change talk is the answer. Like, how would your life be better if you were able to, make these changes to your diet that you want? Like, somebody's like, oh, I would have less heartburn. I would feel better. I'd have more energy. It's like, that's all change talk. And so I can keep that darn CAT acronym in mind and ask questions that are going to address these areas. Like, why do you want to do it? How would you do it if you were going to? Why do you think you need to do this right now? What would be the first step if you were going to make this change? And then kind of like what, Tammy's saying here, like, what would it look like if you did know? And so you're just being, very intentional in your questioning to get the kinds of response that you're looking for, you're helping elicit from them. We do have, so this will be some strategies that you can come back to and look back at the slides to remember whenever you're trying to get more change talk from your peers. So one strategy you can use is asking about extremes. You could say, well, you know what, maybe you don't change. What are the worst things that could happen if you stayed like this? And usually people, are like, no, I don't want to stay like this. But that can be super helpful. You can look into the past and future. Like, how would you feel, or how did you feel in the past? Like, when you stopped drinking, what was that like for you then? How do you think you would feel in the future if you stopped drinking? You can explore goals and values. Like, you're like, I know that your independence is really important to you. And so, like, being able to earn your own money is super important. But whenever you're drinking and you're not able to keep a job, it's like, that's actually looks like it's hurting your independence. So that would be a way, that I could explore goals and values, and really emphasizing that independence or autonomy piece, to get them talking about what maybe they would want to cut back on drinking. Another strategy, this is probably the thing that people remember the most from any talk on motivational interviewing, is an importance ruler. And so this is like a great strategy that you can tuck in your back pocket, where we say, so if I was talking to Mary earlier, I could have said, Mary, how important is it for you to, keep your apartment on a 0 to 10 scale? And, maybe she tells me like an 8. And I would say, why did you say 8 and not a 5 or a 6? And so she would come up with all these reasons, like, well, keeping her apartment is super important to her. So the way to, once again, to ask this question is you ask how important something is on a 0 to 10 scale. And then whatever number they give you, you compare it to a lower number. So if I said, how important is it for you to stop drinking on a 0 to 10 scale? And maybe they tell me a 3 out of 10. Then I'd say, well, why did you say a 3 instead of a 1 or a 2? And when they start answering that question, they're going to give you reasons why they would want to change. And you can also ask, like, how would cutting back on drinking affect your ability to, maintain your independence in the future? So I'm connecting a behavior with a value. Or how would cutting back on drinking, affect your ability to, be a family man or something if that were important to that person? So once again, the goal is to get as much change talk as possible. And so now we want to talk about, well, what do you do when your person starts giving you change talk? What do you do if they're giving you sustained talk? And what do you do if they get mad at you? Because that can happen too sometimes. Okay, so responding to change talk. So how would you all, well, I don't want to answer that question. So from what you know about motivational interviewing, what do you think your goal would be in responding to change talk? So if you're getting change talk from someone, what do you want next? Yeah, I want as much of it as I can get. Like I told you earlier, this is gold in motivational interviewing. So I want to get as much um, change talk as possible. Yeah, so encourage it and find out why. We want, positive outlooks, which are going to be a part of the change talk. So this is a harder question. What strategies have you learned thus far that would be appropriate to use in response to change talk? Brad, you are right again. Okay, so you are getting a little ahead of me, but you're right. That is one of the things that comes next with setting goals and stuff. Yeah, so affirmations, praising, and we're going back to our or skills. So I can ask more open-ended questions. I can make affirmations. I can make more reflections. I can make more summaries. Till the point where we're just in a cheerleading session, and it's like, yeah, you want to do it, you want to feel better, these are all the reasons why. And then the person's like, yeah, I'm ready, let's do this. That's how you start knowing that you want to move on. Okay, so we're going to use the chat box for this. So how could you use an ORS strategy? What would you say to your person if they said, you know what, I think I really need to start taking my medications? What would you tell them? Yeah, that's a great one, Carrie. Is like, how did you come to that conclusion? Um, how's your life different when you are taking your medication? Yeah, but you're reflecting it back, like you're tired of this up and down. Like you're really ready to have some more stability in your life. Yeah, you're reflecting. You sound ready to make some changes. Yeah, great responses there. And I realize I'm running out of time, so I'm going to skip the next one. But it's so easy just to, like, whenever you get the change talk, to just jump straight into planning. And but watch out for that. Because you can really just hang with this a little bit longer, and have them really describe, why they want to make the change, and it will stick with them longer if you do that. Okay. So what do you do if they say, oh, I don't want to start taking my medication? I'm not so sure about that. It's like actually, anyways, they're describing like I think I want to keep drinking. It's like it's too painful to think about all the things that I think about if I'm not drinking. So what do we do if we get this kind of talk? So sometimes we can use our reflections again. Maybe I say, you're just not really feeling like now's the time to make a change with your drinking. And sometimes, like when you do that, people will start arguing for the alternative. Like, well, I didn't say that. Well, I'm still interested. But if you reflect it back, then you open up the door for them to respond that way. Or sometimes you can use an amplified reflection. And well, this is going to come down to the kind of rapport relationship you have with your peer about the appropriateness of these. But you may say, you know what, maybe your life is as good as it could be right now. And so you're just really don't, want to make any changes at this point. And so it's a little more controversial. But you may get once again, so you kind of have to know what your relationship is like and if you can bring that up. Another helpful one is double-sided reflection, where you reflect their sustained talk and then you reflect some of the change talk. You may say, you're really not sure that you're ready to quit drinking and you would really like your life to be different in the future. So I'm, kind of saying both of those things at the same time. And then another really helpful thing when you get sustained talk is emphasizing autonomy. Really kind of relying on, I'm here to help you do what you want to do. And so I'll help support you in whatever that is. But ultimately you have to be the one that decides that they want to do this. Other ideas, we can reframe. You could suggest a different meaning or perspective about something. They're funny names. Agreeing with a twist, so you can reflect and then reframe. So maybe I would reframe the drinking one as something like, it just doesn't sound like you're ready to confront, all the stuff that you're avoiding from your past. So it's not really about quitting the drinking; it's about confronting, these other things from somebody's past. Sometimes if somebody has a lot of negative things to say, a lot of sustained talk, it can be helpful to say, tell me all the reasons, why you would want to continue drinking. Okay. Like any other reasons that you can think of, any other reasons? Okay. Now tell me all the reasons why you would want to quit drinking. So you kind of like get all this stuff out of the way, like all the things, that they're going to be hemming and hawing about, and you try to get it out of the way. And then you can focus more on the change talk. Sometimes, yeah, coming alongside, agree and add over amplification. And then what do we do with signs of discord? So if your person is getting defensive, they're squaring off and saying like, I don't need you to tell me what to do. Or they're interrupting you, or they just feel really disengaged, they start tuning out. What do you want to do in those situations? I think the number one thing is trying not to take it personally, which is really hard. But our goal is to help them change their behavior, and so if I take everything personally, that's going to inhibit my ability to respond objectively. We can use all of those different sustained talk strategies that we were just talking about. Sometimes we can apologize. Whenever I worked at the VA, I oftentimes found myself apologizing for the entire VA system, and I didn't have any role in that at all. But I could acknowledge, how difficult it was to navigate that bureaucracy. And so, I could apologize for that. I can use affirmations. So Carrie, like thinking about things from their perspective, trying to put yourself in their shoes. Maybe I shift my focus, but I'm really trying to avoid confrontation and helping them feel understood, without taking things personally, which easier said than done, but possible. Okay, so let's talk about evoking confidence and developing discrepancy. So much of what we've talked about so far is focused on discussing the importance of change and why somebody would want to make a change in their life. What additional factor is going to be fundamental to behavior change? So if we've established that this is important, what else do people need to be able to change? Some of you were saying this earlier. Okay, so we got will, seeing the rewards or benefits, having autonomy or making the choice, motivation, support. Ooh, not exactly what I'm looking for. Oh, geez, you all are describe action and hope that changes pot. Oh, Brad, nailed it again. Confidence. That's what we're looking for. And you all are describing, what it would take to feel confident. So I've got to have something has to be important to me, and I have to be confident in my ability to do it in order to make the change. Something could be important to me, but if I like, maybe it's like I want to go to outer space, and it's like the most important thing in the world to me. But if I don't know how to get to outer space, it's probably not going to happen, right? Or I could be the most skilled astronaut, rocket scientist in the world, but if I don't care about going to outer space, then it doesn't matter either. So you have to have importance and confidence in order for behavior change to happen. Okay, so how can we help strengthen somebody's confidence in their ability to change? So we're going to go back to our OR skills again. I'm going to ask open-ended questions that focus on my peers' ability to change. I can use my confidence ruler again. Earlier it was an importance ruler. Now it's a confidence ruler. And I could say, how confident, are you in your ability to abstain from drinking? And let's say they say a 5. I would say, what do you think it would take for you to go from a 5 to an 8 or a 9? And then that person is going to tell you what they would need to do to, have more confidence, or what it's going to take for them to be successful. We can also, this may be a time when maybe they say, I'm not sure. I don't know what it would take for me to go from a 5 to an 8 or a 9. I would say, yeah, I hear you. It can be like pretty overwhelming. Like, do you want to know like what I know has worked for me or what worked for other people? So now I'm asking for permission to give information or advice. But I'm not going to do it unless they ask me for it, but I can, put myself in that situation. And some of you were saying this earlier too. You can identify and affirm your peer strengths and say, you know what? I've known you've done some other really difficult things in the past. How are you able to do those things? Could you apply any of those skills or strengths to this current situation? So like that's kind of what I'm saying here. Review peers' past successes. What's something you managed to do that you weren't sure that you were at first that you would be able to do? And then say, how did you do that? You can brainstorm, you can generate ideas to get more confidence talk. Can also be helpful to reframe. People say, you know what, I've tried this before and I failed every time. And I may say, you know what, I don't think of those as failures. I bet you learned something about yourself every time you did that. And now you've got all this, you've learned so much about yourself, and you can keep chipping away at this, and you're just going to get better and better at it the more that you keep trying. Another like helpful strategy is this hypothetical thinking. You say, you know what, let's suppose you did quit drinking and you're looking back at it now. What's most likely that worked? How did you do it? Like, what did it take for that to happen? And once again, it's like really great questions to get people thinking about, what would work for them or what they've seen work for other people that they think could work for them. All right. So whenever I'm doing this, I'm also trying to develop discrepancy, and I'm trying to develop discrepancy between what's important to somebody and their current behavior. So let's say, I've got this silly picture here that this lady really wants to improve her health. That's one of her values. I want to improve my health, and, I want to lose weight. And I may ask them, well, tell me about how, your food choices and, how you spent last night, like how did that help or harm you when it came to improving your health or losing weight? And so like, yeah, maybe I should be focusing more on changing my diet. So you're just trying to point out, the discrepancy between how somebody's acting and what's important to them. Like maybe it's really like you're telling me it's really important for you to be independent, and you know that having a job can help you be independent. And I haven't seen you apply for any jobs. Tell me what's holding you up. Um, okay, so one of the things about developing discrepancy is what we're trying to do is help somebody accept their situation and accept how they've been living may not be consistent with what's important to them. And I need somebody to accept that and acknowledge that before they're able to move on, because they're likely trying to avoid something. And so by developing this discrepancy, what I'm trying to do, it's not in a judgmental kind of way. Like, I know what's best. I'm helping them figure this out for themselves, so that they can accept that, that they have some agency here. They've got some control over this situation. And the more that they can understand how their behaviors, are affecting their situation, the more empowered they're going to be to make a change in the future. So this is a great time to use our elicit, provide, elicit to understand their understanding of what's going on. I had a sleep example, like where the patient told me, she's like, I'm not going to stop sleeping in the morning. And she also has big problems with insomnia. And so I may ask her, like, what's your understanding of how, allowing yourself to sleep in the morning could be perpetuating your problems with insomnia? And I would love to know what she thinks about that. Okay, we can also explore other people's concerns about their peers' behavior, and then say, you know what, I know your grandmother is one of the most important people in your life. What does she think about your drinking right now, or these different things that are going on? And so once again, it can kind of tap into what's important to somebody. We can talk about their goals and values and how, once again, how they're behaving may be consistent or inconsistent with that. Oh, thanks, Tammy. Yeah, I do try to be particular about that. Yeah, so she was saying how I use and versus buts. And it's just a subtle thing that makes a big difference in how you come across. Um, and then we're also trying to honor autonomy. Okay, so key points about developing discrepancy. Change tends to occur when a person perceives a significant discrepancy between what's important in their lives and how they're living their lives. And the discrepancy needs to be large enough to encourage change, but not so large to be demoralizing. Like, we want them to have hope that things can be different for them in the future. And for somebody who's on the pre-contemplation stage of change, your goal at this point, as much as we want them to move to action like right away, my goal is probably more along the lines of helping them become more ambivalent about something, so that they're considering that things could be different. And it just, once again, you've got to meet people where they're at. So if I'm helping somebody become more ambivalent about something, that wasn't thinking about it at all before, that's a big step in the right direction. And as usual, I'm running out of time to do this activity, but the idea here is let's say I'm working with somebody that wants to get a job so he can earn enough money to pay rent for an apartment. He really values his independence. He wants to make his own choices, be responsible for what happens in his life. And he's spending most of his time just hanging out with friends on the street, not applying for jobs, not doing this. So I want to help him make the connection between like what's really important to him in his life, and how, if like independence is really important to him, I want him to acknowledge, like, how is spending your time this way supporting or harming your goal of being independent? And in terms of the alternative, how would having a job support your independence in a different way? And so I want them to be able to articulate that. But that's the kind of thing, that once you understand somebody and what's important to them, and that's why we did that values exercise earlier, then that's going to allow you to point out that, or understand the discrepancies between how they're behaving and what's important to them. All right, so moving on to our last chapter in the last 5 minutes, developing and supporting change. So how would you know that you could start planning and goal setting? So whenever you're seeing a lot of preparatory change talk, people are talking about why they want things to be different. They're moving from contemplation to preparation stage of change. You're hearing this mobilizing change talk, the commitment, the activation, the taking steps. You're not getting nearly as much sustained talk as you were before. And sometimes people have this like kind of sense of resolve where people are like, I just can't keep doing things the way I have. And it's almost like you can see it like come over someone, whenever they experience that resolve. Or I see this like in my dog when she realizes that like we're not going on the walk that she wanted to go on or something, and she lays back down. It's like there's a sense of resolve, that this isn't happening or something has to change. And you all probably know what I mean, like when you see that in the people you're working with, or maybe you recognize it in yourself. A person's talking a lot about the future that they want to have for themselves, what their life could be like different, and how it could be different in the future. Maybe they're asking you questions about change or how they could do that. So one of the things that we can do to transition from this evoking stage to the planning stage is this recapitulation, which is a big word. It's a transitional collecting summary of all the change talk. And you can think about this like presenting a bouquet of flowers to someone, where you're like, this is the reason you wanted to change. This is a reason you wanted to change. This is a reason you wanted to change. And I'm presenting all this back to the person. It's like, this is why you wanted it. This is how you said you're going to do it. And then we're like, so where does that leave you? What are the next steps? So what are you thinking about all this at this point in time? Like, what do you think could work for you? I wonder what you may decide to do. And once you get that, it's like, then you can start moving forward with making plans. This is such a hard time to like hold on to your horses and not get carried away, because you're just like really want to help them. And it's like, you're getting so close, but you still want them to come up with the plan, or ask you for help in that. So we watch out for the riding reflex, which is telling them what to do. Like, all right, now we got you where we want you. This is what you got to do now. It's like, once again, you want them to come up to that plan. We want to stay attuned to how they're responding to us. Like, are they giving us change talk? Are they getting sustained talk? And we really try hard not to get ahead of their readiness to develop and commit to a change plan. We want them to come up with this and feel like they're ready when the time comes. And I want them to come up with their plan, where I'm helping them kind of detail it and asking clarifying questions so that they come up with it themselves. Or I guess together with me supporting them. So moving on into goal setting. And this is kind of a little more elaborate, but sometimes we're setting short-term, intermediate, long-term goals. We kind of want to be thinking about the big picture. And, once you identify long-term goals, you can start working backwards and setting short-term goals. We want to focus on goals that people will know that they accomplish when they get there. And we also want to set goals that help increase their sense of success and are supporting their self-efficacy or their confidence in changing behavior. So I may set lots of little incremental goals to help somebody feel like they're moving forward. So maybe we're making a list of maybe I'm reaching out to friends about finding a job, and then I'm creating a list of different places to apply, and then I'm gathering the job applications, and I make each of those a specific goal so that somebody can kind of check them off the list as they go. And I may also want to set goals that are, helping people feel like they're accomplishing something or enjoying what they're doing. I'm guessing lots of you are familiar with the acronym SMART. So when we're goal setting, we want to help people set goals that are specific, measurable, attainable, relevant, and timely. And we could probably have a whole class on SMART goals, but those are different things to keep in mind when somebody's goal setting. And then scheduling activities. If I can get to this point, we want to set goals and schedule activities to achieve their goals. The more specific you can be, the better, with specific times and locations. You can use environmental, social contingencies when scheduling activities. So this is just saying, like, go with somebody else or I'll meet you there, kind of thing. And you can help them find group activities, plan activities with friends, sign up for events. Just a couple more slides here. We can also break activity into as small steps as necessary for people to feel confident. You can help them think about what they may need, transportation, who they're going to go with, and just, try to get into the details and make a really straightforward, solid plan, and try to be as realistic as possible. All right, so we've walked through all 4 processes of engaging our peers, focusing on specific problems to work on, evoking change talk. And then once we have enough change talk and the person's ready, then we move on into the planning phase and start helping them set goals. So I think this is my last slide, and we're right at 11:30. And these will probably turn more into reflection questions and answering now. But I want you all thinking about why you would want to use motivational in the future. How do you think using this could affect your work as a peer support specialist? And then I will make you answer this last one. How would you know it's the right time to use motivational interviewing? When's the right time? There we go. Always. It's never a bad time to use motivational interviewing. Thanks, Cheyenne. Brad, it's who we are. Yeah, you're always in the spirit of motivational interviewing. Great answers. All right. Well, thank you, everyone. I really appreciate your participation. It makes it so much more engaging when you all are using the chat box and answering the questions. So if you all have any questions for me, feel free to shoot me an email. I'm happy to hang around and answer any questions, but I've got a feeling we're gonna close it pretty soon. But anyways, I'll turn it back over to Mary, and we'll see if any questions come up.
Thank you, Dr. Davis. What a wonderful presentation. Wow, lots to digest. I want to remind everybody to check your confirmation or reminder email for the full CEU requirements. I did put Dr. Davis's email in the chat. It's above the thank yous that I see are rolling in right now. You'll receive your evaluation email in your inbox within an hour, and you have to finish it within 48 hours because it'll close. You have the option to redo while you're in the survey, and you can do the survey as many times as you want in that time frame. I'll send an email tomorrow with the survey link in it, in addition to the one that you get today. You can directly question us at empoweridaho@janus.org. We provided you that email earlier, but I can slap it in the, Ian already put it in there, in the chat. And the slides I'm recording will be available on the website in a few days. Really appreciate you all attending. And once again, thank you so much, Dr. Davis. It was a great session.
Yeah, you are all welcome. Well, take care, everyone. And like I said, feel free to reach out with any questions. Good luck.
Thank you.